So let's move ahead. So this was the question that was shared day before yesterday. So I would like to start with this question only. That this was asked last to last session. Okay, and flaps form an important part for your question. So you will get one question either from incisions or from flaps. Definitely, you will get it. So this is basically the what is the surgery being performed. We had discussed it, that is commando surgery. Remember the full form. Then diagnosis, generally this extensive surgery is generally performed for CA oral cavity, subsite, generally buccal mucosa, or gingivobuccal sulcus. But it can vary also depending upon place to place. But this can be a safe side answer, which will help you to get through it. Anyone else? No. Then the flap being reconstructed, yeah, it's an easy go. This is a PMMC flap. PMMC is the one of the most commonly asked flaps to you, but don't underestimate the importance. It's a very common and very much repeated question for you. Apart from PMMC, please remember the LD flap. This will be asked to you in various ways or the other. Apart from the others, okay, ये दोनों भूलने नहीं है. Then two more. One will be Rintala flap. Very common OSCE based question. We'll be seeing this multiple number of times. I'm just mentioning it so that we remember it. कि हाँ ऐसा भी पढ़ना है हमें. Okay, what is the main blood supply of this flap? So it's an easy go. The blood supply of this flap is pectoral branch of, if you want to answer in one go, thoracoacromial artery. Additional also you can place, but I think that should be okay. And any other two flaps that can be used to reconstruct? Yeah, it is RAF, ALT, anything you can add. Okay, so this is a common question. Common, if you remember the section of maxillectomy that we had seen, they had asked which flap will you use for recon of a maxillary defect, similarly for a mandibular defect. So these specifics you should remember. So this is an easy go. Full marks you can achieve in this kind of question if you have practiced it once or twice. Okay. So after this PMMC, let's start with today's question. यहाँ से I'll be needing little bit of your help also. So this is the first drug for today. Add this drug to your pharmac list. Okay. By the end of this session, not this session exactly, till we reach your practicals, you should have around 15 to 20 drugs ready in your kitty with all three possible questions. What is the mechanism of action? What is one used in ENT? Or if anything specific is related to that drug, that should be known by you. Okay. So for bevacizumab, can somebody help me? What is the mechanism of action?
So anti-VGF factor?
Yes, doctor. Absolutely correct. VEGF inhibitor है. And anybody with the users in ENT, any one or two use?
Respiratory papillomatosis, juvenile.
Yeah, this is juvenile onset recurrent respiratory papillomatosis. Anything? Okay, so they'll ask you medical management of NF2. Remember the drug. Okay. Apart from this, also used in hereditary hemorrhagic of telangiectasia. Okay, these three places this is being used. Let me put two important questions here only. This RRP and Rinke's edema. This will be repeated multiple number of times, but make a note of it. This is important question. The image, the endoscopic image, the grading system too, and the treatment. All three are important. Please remember it, how to go about it. This is an important question. Please, I'm just mentioning it here only. Bevacizumab ke, there are few cousins that you have to remember. You should not forget cetuximab. You should not forget omalizumab. Sounds simple, but it is important, can be asked. Two over here, and let's revise last drugs which we saw. Now, uses of these last two drugs. Anyone? Uses of cabozantinib and vantinib?
Cabozantinib.
Medullary serous thyroid. ठीक है, don't forget it, it's important. है ना, keep on revising it. So after today's class, please make a list. है ना, 5 आपके सामने इसी पेज पे है. ठीक, I think 5, 4, 5 we have seen till now. Please make a list, keep compiling it. If you wish that you will remember everything on the last day, वो नहीं हो पाएगा. You will definitely forget it. It's not your mistake. Human mind is not trained for that. Okay, so if you know that I will get one question like this, so prepare for it accordingly. That's my advice. I mean, lots and lots of time is there for you, so act accordingly. Okay, so moving to the third question from here. Now again, this is an easy one. They are giving you a scan and they are asking what is the pathology over here. Then there are few specific questions related to that particular pathology. So can somebody help me? What is this? I'll give you a hint. If you see this,
vestibular shanam.
Okay, doctor. Now I'll add one more thing. You will see this and you will see this. Now what is the answer? Bilateral vestibular schwannoma. अभी कुछ दिमाग में click हुआ? Anything clicked? Now see the question. Identify the condition. What is the screening protocol and what are the treatment options that are available to you? So doctor, anywhere you see, हाँ बोलिए doctor. Okay, so whenever you see bilateral vestibular schwannoma, the first thing that should click in your mind is NF2. Okay, this is important. This is around 5 pages chapter from Scott Brown. I have included most of the images and table today only in this section only. After this class or maybe tomorrow, take out 10-15 minutes for NF2. It is important. Please read it. Okay, so whenever you see something called as bilateral vestibular schwannoma, ये image याद रखना, ठीक है? This will come to you. This is important. Okay, now we'll see about what is screening protocol and what are treatment options available to you. So doctor, there are 2 things more associated with NF2. Let's see it here only. First is there are plaque-like lesions. Second is there is subcutaneous schwannomas. Okay, these 2 features are there. इनका भी image है. Now there is a name. Name is there for the diagnostic criteria. What is the name? The name is Manchester diagnostic criteria. They might even ask you कि इसका एक modified version आ चुका है. The name is Baser criteria. This is another. Okay, both of them are given in Scott Brown. Okay, I have not included anything else apart from Scott Brown. Please remember it. Now this is first point. Second point. Third, can somebody help me with the location of NF2 gene? I'm sorry, putting all the details over here, but this is important. Location of NF2 gene. Please remember chromosome number 22. ठीक है? 2 bilateral 22 chromosome 22, and there is a very common, this Merlin is associated with it. Please remember it. Okay, and then comes the screening protocol. The screening protocol is important. Please pay attention to that. They might ask you what is the screening protocol. Please describe it for 2 marks. Okay, so the screening for vestibular schwannoma in NF2, this starts at 10 years of age. If a person is at risk for NF2, the screening will start at 10 years of age. And the second point is that MRI is done every 2 years if age is less than 20 years, and MRI is done every 3 years if age is more than 20 years. Please remember it. This is the screening protocol for NF2. Okay, just revise once again. 2 lesions, plaque-like lesions, subcutaneous schwannoma हो गया. There are 2 names, Manchester diagnostic criteria and Baser criteria. Gene में chromosome 22 Merlin, and this is the screening protocol. Okay, 10 years of age, MRI every 2 years if the age is less than 20, or every 3 years if the age is more than 20. Now these are the 2 images which can extra be asked. This is the plaque-like lesion. This is the plaque-like lesions on the arm, 1, and second, this is the subcutaneous schwannoma. Okay, please remember it. This is important. And this was that diagnostic criteria that we were talking about. This is the Manchester diagnostic criteria. Manchester diagnostic criteria. Okay, so please remember NF2. It is important for you. Very likely to get one question either from NF2 or from vestibular schwannoma. इन दोनों में से एक में से पक्का आएगा. And let's see what it is. Now, this is an actual question from your main DNB exam. I think 4-5 sessions back this was asked and it was repeated also. This is an old question. I think of 24 या 23 session का है ये. ठीक है. So what is the answer for this? Can somebody take a try? Single side. Now this becomes your vestibular schwannoma. ठीक है. This becomes your vestibular schwannoma. Okay. Now, what is the sign which is seen on the MRI? Can somebody help me with the sign?
Cerebral. This one ice cream cone.
Yeah, this is ice cream cone sign. Okay. So absolutely correct. This is a ice cream cone sign. ठीक है. Then they're asking name the contrast which is used in the scan. Anybody? Gadolinium. Absolutely correct. Now these two questions we'll just see in another 2 slides. I have something for you. Okay, now just see. I'm decreasing it. This is the image of Scott Brown. Okay, and this is your actual image. Exactly same to same they have given. Okay, so that's why I keep on repeating. Please open your eyes, adapt your mind, so that you can see whatever this chapter you would have studied, if not at least 5 times, 10 times from your Scott Brown for the last 3 years, when you are preparing for your exams. Okay, so we have to train our mind कि हाँ इसको तो मैंने देखा हुआ है. I've seen this image. This is from some particular thing. So believe me, about 10 to 12 questions will be there from your main book only. Okay, so keep on revising the basic things. Additional will keep on implementing in between में डालते रहेंगे. ठीक है, so you have to go about it. Now, there are 2 things over here. What is RION and what is pseudo progression? So I'll help you with this. I'll write it.
Radiation.
हाँ बोलो.
Radiation induced optic neuropathy, sir.
Yeah, doctor, absolutely correct. Radiation induced. This is I'll say a puchalla question, a sequelae question for vestibular schwannoma. They have not asked it till now. Okay, so but potential question given in Scott Brown, absolutely crystal clear answer for that. Radiation induced optic neuropathy. It generally occurs when the exposure is more than 8 grays. Okay. Please remember it. This can be asked to you, and there is one acronym that is being 1 or 2 acronym that will be asked to you. 1 से 2 number का आएगा. This is one potential MCQ for that. Okay. Now there's something called a pseudo progression. So what happens in pseudo progression? Once you apply the radiation therapy to the tumor, that is the vestibular schwannoma, there is either a static or there might be a increase in size of the tumor after the radiation surgery. Okay, followed by the decrease. So this increase, this is not real, but it generally appears a few weeks after surgery. This is called as pseudo progression. What is pseudo progression? Pseudo मतलब होता है false. ठीक है? So it is like after the completion of radiation therapy to the vestibular schwannoma, there is an increase in size of the tumor for few weeks. So this is actually not true. This is called a pseudo progression of vestibular schwannoma after the radiation treatment. Okay, please don't make it wrong. It's a easy go. आता है तो इसको गलत नहीं करना है. Let's see this. Okay, why I have put it over here, we'll just see. Okay, first this point. Okay, SRS is generally recommended for tumors less than 3 centimeter in size. If it is given to tumors more than that, you can have swelling post surgery, which can lead to fourth ventricular distortion and obstructive hydrocephalus. Okay, and second will be this one. What is pseudo progression? This is, I took it from here. Ryan also from the similar page. So this is the answer for your 4th question. But what will happen if you देखो पहला question तो first they will ask what is the size for SRS, that you have to remember. It should be less than 3 centimeter. And इसके बाद भी they can ask you कि they have actually asked that only कि अगर 3 centimeter से ऊपर है तो what will happen? What will happen? There will be obstructive hydrocephalus. Okay. Now there is a named curve in vestibular schwannoma by the name of Nelson-Arrhenius curve. Vestibular schwannoma. Vestibular schwannoma short form है VS करके लिख रहे हैं. It means vestibular schwannoma. The name of that growth curve is Nelson-Arrhenius curve. Okay, it depicts the growth of vestibular schwannoma. There are two named curves that will come across. One will be Nelson-Arrhenius curve. Second will be Kaplan-Meier. Okay, this already being asked. They have asked it twice till now. Nelson-Arrhenius till now they haven't asked. Okay, so potentially if it gets repeated, you'll get Kaplan-Meier. If it does not get repeated, new question is there, so Nelson-Arrhenius. Please remember it. In same chapter of vestibular schwannoma, you'll get this one. Okay. Now coming to this, expand TAUS and one used in ENT. Let's go with this. TAUS is transoral ultrasonic surgery. Okay. Uses in ENT, generally used for initial tumors of your tongue base, resection of them, tongue base, retromolar trigone, supraglottis. You can add your favorites also over here. Okay, so remember this TAUS, full form, advantage, one use. Setup की image याद रखना. This is the FK retractor which they are using. Okay, so multiple retractors will come across your way and they'll keep on pressurizing you. Okay, now this is again, I'll enlarge it. Okay, I'll enlarge it. They're asking what is this yellow arrow pointing at. Okay, so this is basically a canal by the name of Sternberg Canal. This is important. Okay, Sternberg Canal is important. They will ask you what it is. ऐसे पूछ सकते हैं. They might ask you how is it formed. So this is basically formed by incomplete fusion of greater wing of sphenoid to pachysphenoid. Okay, remember the Sternberg Canal and its importance. This is again one more image of Sternberg Canal. They can even ask from this also. Okay, so whenever you read any topic, just put on Google, go and see 2-3 more images for that. If the examiner doesn't repeat the same image or the same OSCE, concept gets repeated. Definitely it gets repeated, if not the same image. So they will give you another 3-4 images. इतना ही मेहनत हर कोई करता है, ठीक है? No one works harder than this. कि ऊपर के जो Google results में 3-4 के अलावा कोई नहीं जाता कहीं. You will get whatever top 3-4 images comes into the Google feed. Please at least एक बार उसको just refresh it and see it. Is there something new which is getting missed from you? Okay, this image is from Scott Brown. Okay, so whenever you see something of this sort, na, illumination, stars, moon, इस तरीके से something shining, whenever you see, this is basically your image guided surgery or the navigation surgery. Again, this image is from Scott Brown. Okay, it's used in ENT. It is used for surgery of frontal recess, revision sinus surgeries, in surgeries where the landmarks have been lost, there are no landmarks, then in multiple आपका neurological surgeries. Here only I'll again bookmark. Boundaries of face is a must know. Very important. Please read it. And इसके बाद draft surgeries. They will ask you what if draft फलाना, what if draft दिखाना. They will ask you. Please remember it. It's a very important question. You'll see it in the plunge into the radiology section. But I'll keep on mentioning the important questions that will come across Keep reading it. Now, this one. Can somebody help me with the full form of this smell identification test?
UPSIT, University of Pennsylvania.
Yes, Doctor. Absolutely correct. University of Pennsylvania smell identification test. Please see the spelling also. University of Pennsylvania. Please check the spelling once, huh? Smell identification test. UPSIT. You write this much, you'll get 1 marks for that identification. What extra questions they can ask you for that is, first is there are 4 booklets of 40 odorants. There are 3-4 things to remember. 4 booklet of 40 odorants. And this is also called as eye chart for the nose. Eye chart for nose. Now, one interesting anecdote from this UPSIT, it is very close to my heart. Why? In my Viva for DNB, my center was in Nanavati Max Hospital, Juhu. Okay, I got this as in table Viva, and that हमारे जो examiner थे, he gave it to me. Okay, tell me what it is. I was very happy. I knew that this is UPSIT. Okay, somehow I recalled that this is the University of Pennsylvania smell identification test. Now the question started. How many booklets are there? All those things. ठीक है, I was pushing and then I was like, ठीक है, रुक के अटक के I was able to come to the answer कि ठीक है बोल दिया. Now he asked me, Doctor, how will you how will you scratch it? There is some odorant over there. How will you scratch it? I was like, okay. So he was like ऐसे looking at his fingers. So I was like, yeah, ठीक है, nail से scratch कर देंगे. So he just smirked at me. हाँ, okay, you don't know anything types हैं. So remember this thing. They have a pencil tip over here. Okay, so you scratch it with the pencil tip. Okay, don't forget this thing. This is important. UPSIT full form also they can ask you, and similar this image or some other image they can give and ask to you. Okay, so coming to the next question. These are short questions only, not much of extra thing for that. Let's see what they are asking. They are saying study these 3 images, and they're asking what is the name of the investigation, one advantage, one use in ENT. So basically, for including this image over here, my whole idea was to brush your OCT. ठीक है, OCT मतलब optical coherence tomography. So this is basically OCT. What is OCT? Optical coherence tomography. I'll pinpoint the important points that you have to remember. Must note है, ठीक है, उनको नहीं भूलना है. बाकी whenever you have 10 minutes with yourself, please revise it. सिर्फ 10 मिनट का चैप्टर है, बहुत बड़ा नहीं है. It's a small chapter. You can revise it easily in 10 minutes. Okay. So what you have to remember first, that there is a high resolution of image. Okay. Second advantage, there is cross-sectional imaging. Third point, the magnification is 10 to 100 times of MRI oblique USG. Data is from Scott Brown only. I've checked it twice. Okay. This is the amount of magnification, the amount of resolution that it provides, 10 to 100 times from that of MRI. Okay. Now, fourth point, that this is an in situ investigation and a non-invasive, non-destructive, no damage, no pain to it. Okay, so this is how these are the 4 points that you have. Then you have something called as like what will be the uses in ENT. So in ENT, basically 3-4 uses, multiple uses are there. Just enumerating few of them. It is used to evaluate cartilage of trachea or bronchus. Then this is used in pediatric subglottic stenosis. Then apart from that, in otology section, This is used for localization for electrodes of CI. Localization of electrodes for cochlear implant. Okay, there is one more full form which can be asked. What is the full form of OFDI? This OFDI is given in data is from Scott Brown only, nothing from कहीं और से नहीं है. So this means optical frequency domain imaging. So this is a recent advance in OCT. Okay, apart from polarizing OCT, this is one of the recent advance. And there is one name of this infrometer. The name is Michelson Infro. Sorry for the bad handwriting. Okay, so they might ask you what is the name of this device which is being shown. Ideally, itna sadistic question they don't make, but be ready. You can get it. Okay, so this is how you should revise the OCT. इसके अलावा additional knowledge, whatever you want to add, please keep on adding. But remember the important points. Remember the uses in ENT. Remember the full form of OFDI and polarizing OCT. Now we have 10th question. Now identify the image which is being given. So can somebody help me? Try. Easy one.
PET scan, sir?
PET scan, doctor. Absolutely correct. Okay, this is a PET scan. Okay. So this is a PET scan. Now they are asking full form of SUV. Okay. So SUV is basically standardized uptake value. This is an easy go. They might even ask you how to calculate SUV. So remember this formula. This is from Scott only. Tracer. Sorry, I'll make it a little bit clear. This is tracer uptake divided by administered activity upon patient weight into 1000. Okay, so this is one of the questions which can be asked. Then they're asking name one radio tracer other than FDG. So we all remember FDG, huh? FDG का full form तो we remember, but एक extra please remember it. This is thymidine. Sorry for the long name, but no, cannot help it. 3-deoxy, 3-18F fluorothymidine. Okay, short form में they call it FLT. Apart from that, 11C, choline, F-meso, all these things are there. And one radio tracer for detecting hypoxia, this is F-meso. This is all these things are from your Scott Brown only. So whenever you revise the chapter of PET scan, please make sure the 3-4 points that you have to revise extra apart from the routine studies. Okay. Okay. Now coming over here. No. Can somebody help me with this cat? What is this? This is SPECT. Even the acronym is also important. They can ask you what is the full form of SPECT. Can somebody try? Single positron emission computed tomography. Good, doctor. On emission computed tomography. Coming to the uses in ENT, uses में आपको use in skull base osteomyelitis. Then it is used in your parathyroid imaging. Then it is used in your sentinel lymph node biopsy. And potential use आपका CSF leaks में. Okay, so please remember this thing. All the acronyms that you are getting used to, please make a separate PDF of it if you are a soft tech type. Else अगर आप paper pen से पढ़ाई करते हैं, so please make a page where you write all the acronyms at a single place. So that will help you in your revision. When you will sit down to revise, it will help you. Okay, you will be having around 15, 20, 25 acronyms that will be easy to revise at single place. So please remember this fact. Please remember the images that we saw, I think, day before yesterday of your functional MRI, parallel imaging, the image of bold. Okay, so all those things are also important. The problem being that all these things look similar. So that is the problem. So the only solution that you can get on is that revise it multiple number of times before the pressure of exam sets in. एक बार एग्जाम का प्रेशर शुरू हो जाएगा फिर तो मतलब ठीक है, मतलब मेन थिंग्स यू विल रीड, दिस थिंग्स आर लाइकली टू गेट skip. Okay, so coming to the last image for today. Image is again of squadron. I have not framed the question for that, but this can be a easily framed question. They can give you this thing and they'll ask you what is being shown in the histopathology image. Okay, they might give you a clinical history that a patient came with complaints of epistaxis, he came with complaints of bleeding or a known case of JNA, something like that, and a procedure was done. And this is the cut section, इस तरीके से. So this is basically, I'll just okay, so this is, I'm just enlarging it this only, that this is showing the embolization particles which are there within the tumor vessels. Okay, this is the embolization particles which are there in the tumor vessels. So embolization is an important topic for you, even this thing also. Okay, this is a diagnosis of this case of JNA, juvenile angiofibroma. They can even ask you what is A. You can give you like this. This is A, this is B, this is C, and this is D. Okay, 4 images, and they'll ask you what is the diagnosis A, what is the procedure being performed. Question number 2. Question number 3. Name 2 agents for the above procedure to be performed. और इसी के हिसाब से you will get some advantage, some disadvantage. Something called is venous blush. Please remember this. This is a potential question. Okay, venous blush. So bookmark these things. These are few of the important things which we see from Scott Brown. एक बार Scott Brown complete हो जाएगा तो then we'll scrape off these important images from your comments, Lalwani and your Stellan Marath, जो अभी extra questions आएंगे आपके. ठीक है. Wanted to keep this class again short. Okay, so around 15 questions were there. So if any point from your side, Dr.